evening, everyone. So I'm really happy to see Sheela giving us a talk on Chinese medicine. And some of you don't know, I mean, you see her every day at 8 morning pranayam class in California. It's 6 a.m. and she's up there and attending. Yeah, sorry, 5 o'clock. Yeah. And she's attending every day, almost every day. So that's wonderful. Very requires dedication. And some of you may not know that she's a doctor. She's a medical doctor, and she's also has worked in the Air Force most of her career. She's a lieutenant colonel, and she retired as a medical director of cytopathology, microbiology, and also point of care testing of clinical laboratories in Travis Air Force Base in California. And she has many years of experience at various Air Force bases, including Andrews Air Force Base, Travis, and maybe many more. And she has keen interest in Chinese medicine and acupressure or acupuncture, and she's licensed to practice acupuncture, and she will be talking about the basic concepts of Chinese medicine. So with that, Sheela, we can start, and I will help you with the sharing the screen whenever you want it. And keep your mics off, so that it's okay to keep the video on, but keep the mics off. And go ahead, Sheela.
Okay.
All the best.
Yeah, thank you very much. Namaskar to everyone. And I would like to start my talk with a small invocation. This is to thank all the gurus who had given me the knowledge in allopathic medicine as well as the alternate medicine. And my pranams to everyone. Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Gurur Sakshat Parabrahma, Tasmai Shri Gurave Namaha. And next I would like to give my pranams to the Almighty. Tvameva Mata Chapita Tvameva, Tvameva Bandhushcha Saka Tvameva, Tvameva Vidya Dravinam Tvameva, Tvameva Sarvam Mama Deva Deva. Thank you very much. And next, Guruji, can you start the slides? Can you put on the first slide?
Yeah.
Thank you.
Okay.
And, yeah. As Sri Sabnitji introduced me, I am Sheela Rajan, and I am a medical doctor by profession, a pathologist with more than 35 years of experience. And more than half of my years of experience was as an Air Force pathologist. And after retirement, I did my master's in alternate integrated medical college in Berkeley, and procured my master's degree. And before I start my presentation, I'm extremely thankful to Sri Sabnitji, who has given me the opportunity to be in the Sri Yoga stage to give this talk. And secondly, I would like to show my sincere gratitude and thanks to the Air Force, who had given me by the GI Bill. They financially supported me for my whole 4 years of school, procuring a master's in Chinese medicine. Thirdly, I'm extremely thankful to my very dear friend here, Radha Gopal, who really put all these PowerPoint presentations together. And if you like the PowerPoint slides, all the credit goes to her, not to me.
No, not at all.
Thank you, Guruji. I can start my second slide. So now my talk is based in 4 or 5 different segments. First, I will talk about the basic concepts of oriental medicine. Then I will talk about the meaning of yin, yang, and qi. And then thirdly, I will talk about the comparison of Ayurveda and oriental medicine as far as I could understand. And then I will have my conclusion marks.
Just I want to make one comment. If you have any comments or questions, put them in the chat box. And so after the presentation, we'll go over the questions, and then you'll have opportunity to talk to her, and ask questions directly. Go ahead. Sorry.
Thank you. And the next slide. So this explains the relation of the 5 elements in the environment according to the concept of oriental medicine. These are wood, fire, earth, metal, and water, which are very much like Panchabhuta in Ayurvedic medicine. The concept of wood is wood feeds on from the fire, and they produce ash, and from the ash it nourishes the earth, and the precious metals are formed, and these metals exude liquids like water, and this enables the plants to grow and the trees to grow, forming woods, and again the cycle starts. This is the concept in Chinese medicine. There is an outer circle, which is the growing circle, or the supporting circle, and then there is a controlling circle. That means when the wood is too much, when the wood overreacts and then the roots come up too much, then it will loosen the earth, and then the earth will suffer, and the earth will lose all the moisture, and so that will become dry, and the water element will get depleted, and that will hurt the fire element, and so there is more of heat. This is the concept of controlling factor and the creating factor. Next slide, please. The same concept is put in the oriental medicine. So the fire is represented by the solid red color, heart, and the earth element is represented by spleen. The metal element is represented by lung. Water element is represented by kidney, and wood element is represented by liver. And the other outer components are there, the companion organs. For the heart, it is the small intestine. For the spleen, it is the stomach. For the lung, it is the large intestine. The kidney, it is the urinary bladder. And for the liver, it is the gallbladder. So as I go further, I will tell you what is an yin organ and a yang organ later. Next slide, please. So by now I having completed the basic concepts of the 5 elements, let me talk about the qi. Qi is the life force that circulates in the meridians or the channels. And we have 12 regular channels and 8 extra meridian or extra channels. So the regular channels are representing from different 12 organs. These organs are the solid organs, the heart, spleen, lung, kidney, and a pericardium. Though pericardium is not an organ, it is put it in the same line. The hollow organs corresponding to heart is small intestine, corresponding to spleen is stomach, corresponding to lung is the large intestine, corresponding to kidney is the urinary bladder, and corresponding to pericardium is St. Jaw. That is the triple burner. That is also, it is not an organ as such, it is 3 burners in the human body, which is kind of hypothetical approach. And the other organ is liver with the corresponding gallbladder. These are the 12 regular meridians. And then we also have 8 extra meridians, which are called Dew Mai or Dew Ren, Dew Channel, Ren Channel, Chong Channel, Dai Channel, Yang Chow Channel, In Chow Channel, Yang Wei Channel, and In Wei Channel. Next slide, please. This represents the regular meridian in the human body. As you see, from the hand, there's a channel going. Actually, the lung channel starts from the lung and it comes to the hand. And then from the thumb, the large intestine, that is the companion channel, will go from there to the face. And from the face, the stomach channel comes, and that is how the whole body is woven by these channels, all these 12 channels. So the front of the body, the yin channels, or what is called yin channels, are represented. And in the back of the body, there are the yang channels. I will tell you what is yin and yang in a few minutes. And all these channels, different channels are represented by different colors. And along the channels, there are so many points. And those are the points where you put the acupuncture needles to get the acupuncture treatment. Next slide, please. This is the extra meridian or extra channels. The back of the body, the first one is the back of the body where you have the Dew Mai or the Dew channel. The front of the body, you have the Ren Mai or the Ren channel. And the sides of the body, you have the side of the body, you have a Chong Mai. And all around the body, connecting all these 3 channels, is the Dai Mai or the Dai channel. The interesting point is, you later on, I can tell you, the Mooladhara chakra is the chakra where there is the meeting point of Dew 1, Ren 1, and Chong. The Manipura chakra is represented in the mid of the body, which corresponds to Dew 4 and Ren 4. And then the heart chakra, that is represented in the Ren channel, Ren 17, which is in the center of the chest, around the 4th intercostal space. And then there is the Sasra, this is the crown chakra, that is represented in the crown at Dew 20. So these are the channels correspond to these chakras. That is, I just wanted to tell about that information at this point. And then the Yin Wei channel, Yin Chow channel, Yang Chow channel, Yin Wei and Yang Wei channels are the other 4 channels. And from the channels, I could say that the Yin Chow channel and Yin Wei channels, these are the channels which are on the peripheral portions of the body. That might be the one which are the Pingala and the Ida channels. And the Dew channel represents the Sushumna Nadi. And the Ida and Pingala are possibly the Yin Wei and Yin Chow channels. Next slide, please. So now I would like to talk about the basic concepts, what is yin and yang. So the concept, the Tao concept of yin and yang is the universe is represented by the whole circle, where there is the a lighter part and the darker part. These are the yin and yang. These are the opposite forces which are these are two opposing forces which are interdependent creative forces, and these are opposing as well as interdependent. They cannot live without another. So it is always companion channels. And these are called the yin and yang forces in the universe. And these forces are constantly changing, because as the yin becomes big, the yang becomes smaller, or as the yang becomes bigger, the yin becomes smaller. This is how the whole unity is maintained. At the same time, the yin and yang go back and forth. So in other words, in nature, the yin is represented as passive forces, contracting, cold, dark, soft, feminine force, as well as night. That is the yin, which is represented as a dark spot. The yang, dark shadow. The yang force is the lighter one, which is active, expanding. These are the characters of these forces. They are usually hot, light, and hard, masculine force, and dry. These are the various characters for different these forces in nature. Next slide, please. When you get it in terms of the organs in the body, the yin organs are solid organs. So solid is the nature of yin, and they store fundamental substances. So they are static. In contrast, the yang organs are hollow organs, and their job is to receive the food and then transform the food and excrete. And that is why they are called yang organs. Next slide, please. So the yin organs, which are solid, are heart, and the companion yang organ is small intestine, which is the hollow organ. So the next yin organ is lung. Its company is large intestine. The third one is liver. The companion is gallbladder. The spleen companion is stomach. The other organ is kidney. The companion is urinary bladder. The pericardium is companion with the senja. Senja, a triple burner. This is the other term for senja. So this is the concept of yin and yang organs in the human body. Next slide, please. So having said about the basic concepts, I would like to go to the diagnosis, how a diagnosis is done in oriental medicine. This again goes on examination, palpation, or feeling of the body, and also questioning or taking the history. So under examination, you see, as soon as the patient comes, you want to assess the spirit, and you want to see the face and the facial characters, and you would like to see the tongue examination, and then you do the palpation. Next slide, please. Next slide, please.
That's it.
Yeah. No, the spirit. How do you assess spirit of a person. So you look at the complexion of the person. A spirited person have a lustrous complexion. The eyes are bright and clear. The mind is alert and active, and the breathing is even. On contrast, if a person has a low spirit, he will be usually, he's very dusky complexion, eyes are very glassy or cloudy, mind is very dull, and the breathing is very uneven. So on just examining the initial observation, you can assess what could be the outcome of the disease with these patients. Patients who have a low spirit or a low chi, they will have and they will have a harder time to recover from the disease compared to a person who has a good spirit. Next line, please. So this is the observation of the face. So the first one is the wood face. That is where if you have a prominence of liver or a strong liver in your, the facial expression is usually there. They have a very rectangular face, and they will have large eyes, and the mouth is very wide. And a person who has fire or it is a heart, if the heart is prominent, these patients usually have a small head, and the complexion is very red, and they have a wide mouth, and they have a kind of a conical head. And usually they are like Vata kind of patients, very edgy and very agile patients. The person who has earth element predominant, that means the spleen type, these people will have again a small head, but they'll have a wide mouth and full lips, and they have a large abdomen. And the people who are the metal face or who have the lung prominence, they have a square face, and their nose is kind of very prominent, and the mouth is very wide, and they have a shallow complexion. The earth people will have kind of the earth or the spleen kind of personalities will have a yellowish complexion. And the people with the kidney dominant character, usually they have an oval face, and they have a small head, and they have a very big ears. So the good point you can take is a person with a long ear will have good kidney functioning, and they will have a long life usually. Next slide, please. So the next part of examination is examination of the tongue. The examination of the tongue, in addition to the movement of the tongue, and how thick or thin is the tongue, and also the coating of the tongue, you get several information. The tip of the tongue, if it has any pathology, like if it is, if it had red spots, that shows that the heart is in a fire, or there is some heart abnormality. Usually these are the people who have angina or some kind of heart issues. And if they have little blood spots, they may be the ones who have some kind of heart disease. And usually the heart pathology is represented in the tip of the tongue. The the little above that shows the pathology of the lung in that. And the mid portion of the tongue shows the pathology of spleen and stomach, like coating, fissures. These are all evident in that part of the tongue. So if you see a fissure in the mid portion of the tongue, sometimes You can see in terms of stomach chi deficiencies, and thick coating shows that there is a very heavy coating in the stomach. And the sides of the tongue usually represent the health of liver and gallbladder. And the back of the tongue, or the root of the tongue, shows the pathology of kidney. So if the that part of the tongue is dark, that means there is some kidney issues going on. So looking just at the tongue, you can assess the health of different organs. Next slide, please. The other aspect of examination is the pulse. In oriental medicine, just like ayurveda practice, there is the pulse is taken with 3 fingers. The right side and the left side of the hand give is assessment of 12 organs. The left side of the hand gives the assessment of heart, liver, and kidney yin assessment. And in the more superficial portion, you can assess the health of large intestine, the gallbladder, and the kidney yang. So these are the components of those 3 organs. On the right side, you can on the right side you answer yes. On the right side, you assess the health of lung, and then the spleen and the kidney in. And in superficial portions, you can assess the status of the large intestine, the stomach, and the kidney yang. So there are nearly 28 types of pulses, and it takes more than 30 years for a good practitioner to assess the exact pulse. So the pulse examination is extremely an expertise by itself, and depth of the knowledge will be usually assessed by the reading of the pulse by these physicians. And one another interesting factor is, even before the pregnancy test appears, you can predict the nature of the presence of pregnancy in a lady in a reproductive age, because the pulse is supposed to be like a it's a slippery pulse. That is the name of the pulse, which is, it's a very oily kind of a pulse. And then the if a lady is in the reproductive phase of life, you can predict that she could be pregnant. And then prediction of the gender of the child also can be said, because the in the force of pulse, if it is stronger on the right side, it predicts possibility of a male child. And if the strength is more on the left side, it predicts the possibility of a female child. And then palpation or feeling of the abdomen is not that that very developed in or not very not that prominent in Oriental medicine. Abdomen examination or a feeling is mainly done to see whether there are any tumors, or whether any masses, or whether there is any pain, tenderness. And then you also palpate the meridians, or the channels, where the channels are running on the body. So if you palpate these meridians and if you feel the pain, you have an almost a guesstimate of which organ is in trouble and what organ needs to be treated. Next slide, please. So The concept of health in Oriental medicine is a person is said healthy if yin and yang are in balance, and if the chi circulation is um, vigorous and complete. And then he has to have these three treasures in good order, which I will explain what is the three treasures of the human body. That is usually compared to the candlelight, where the flame is the top of the flame is equivalent to Shen, the mid portion is Qi, and the bottom portion is Jing. The term Jing is used, that is where if a person is healthy and if the Jing is rich, that means that means he has good genetic information from the parents. So his genes are strong and he's more healthy. And the Qi represents the organ Qi, and then your respiration Qi. There's a different Qis in the body. The Meridian Qi, the organ Qi, the nutritive Qi, and there are so many Qi. If all the Qi is good, that means he is more healthier. And the Shen is represented by the spirituality, the alertness of the mind, everything. So if you have good Shen, good Qi and Jing, and then if your Qi circulation is active, and if you are in balance with yin and yang, that means that person is of good health. Next line, please. So according to the Oriental disease, the cause of disease are in three factors. One is the external factors. So you can get disease from the external evil factors like wind, cold, heat, fire, damp, dryness. These are the environmental external evil factors which can cause disease, or it could be from trauma or external injuries or sting from any insects or bites of animals or parasites. The internal factors is, this is what happens when you have your lifestyle is in disarray, like excessive drinking or eating or irregular eating habits or inappropriate eating, overexertion, overwork, mental strain, which is very common here with all the stress factors, emotional disturbances, and then also excessive sexual activity. These are the internal factors which are harmful. The emotional factors, excessive anger. Excessive anger is very detrimental to the health of the liver. Excessive joy, that means over the joy, extreme joy is, it affects the heart. Excessive worry will affect the spleen. Excessive sorrow and grief affects the lungs, and excessive fright and fear will affect the kidney. So these are the emotional factors which are reflecting the disease in Oriental medicine. Next slide, please. So treatments, when it comes to treatments, in ancient days, life was simple. People were very simple. They were usually they were living in harmony with the nature, and then they had good exercise, Tai Chi, Qigong practice. They are mostly hunters and gatherers, so they didn't have too much of food all the time to eat, so they did not have excessive eating or drinking kind of lifestyle. And they wore clothing according to the season. The warm weather, you have light clothing. The winter weather, you were wearing heavier clothing. And then they treated food as a medicine. That means they ate food according to the season. Like in warm weather, you eat light and easily digested food. And in winter, you eat heavier food and warmer food. And then you always uh, um, and do things to stimulate your stomach and spleen chi. So when your stomach chi is strong, that means your Jataragni will be stronger and your stomach acidity, all the stomach juices will be strong, so you can digest the food much better, and then you absorb the food, and then you have healthful lifestyle. And then the last one is feng shui. Feng shui in Chinese medicine is similar to Vastu. So in Oriental medicine, many times they have their house kind of rearranged with the clutter-free and a big entrance, so that the concept is the chi should flow in the house freely, so that you have a harmonious life and living conditions. So these are the preventive aspect of Oriental medicine to have a positive health. Next slide, please. So as time passed, man became more, his life was much more stressful, and new diseases like blood pressure, diabetes, which were not, and they were all considered to be modern diseases. All these diseases appeared, and then the treatment procedures were much more elaborate. So these are the treatment procedures of treatment aspects in Chinese medicine. First one is the acupuncture. So the acupuncture are, I showed you the meridians in the body. There are many points where the chi can be can be activated. And there are at least 365, there are 365 acupuncture points in the body, but usually the acupuncturist do the acupuncture treatment using mostly less than 100 points. But the acupuncture points are the points where you readily manipulate the chi. And this is almost like a button, a radio button. You put the needles and then you activate the chi. The acupuncture procedure, I want to spend a few minutes. Acupuncture treatment is given after doing the diagnosis, and then after coming to a conclusion of what is the pathology in that person. And then the acupuncturist will will come to a conclusion, what are all the acupuncture points he needs to put. And so they will select the needles according to the depth or according to the length and the thickness of the needle. In the back portions of the body, usually you put longer needles and thicker needles because there is a lot more tissue to go in. But in places like face or in very sensitive areas, you put very small needles because you don't want too much of pain. And usually the acupuncture needles are not at all painful if it is put in proper way. And the acupuncture needles are also put in different directions, and then they are put, the healthier the person, you can put more number of needles, maybe like 15 or 20 needles. But if a person is very weak in constitution, you put a very small number of needles. And then usually the acupuncture needles are left for about 30 minutes. So that because the chi It circulates once in the whole body. The chi circulation takes place in about 25 to 28 minutes. That's why usually the acupuncture treatments last for 30 minutes. And when you put the acupuncture needles, you usually go and check the patients for about 15 minutes just to make sure that the patient is doing all right. And then at 30 minutes, you go and take out the needles. And there is a way of putting the needles. There is a way of which needles to be put first and which needles to be removed last. And then even at the time of putting the needles, you need to get the chi of the patients, and then you sometimes you coordinate the patient's respiration, the acupuncture needle puncture. And then also the number of needles you put. You usually you want the patients to have some food in the stomach, not a heavy stomach, not a heavy food. And then you also advise the patients, usually after the acupuncture treatment, they may feel a bit of fatigue, and then you encourage the patients to take more rest at that day. And then there are so many very strict protocols using acupuncture needles, because you need to think about very vital organs when you're putting the needles. Sometimes you put very next to big blood vessels, big nerves. So you have to know the good anatomy of the human body when you put the needles. So these are all the features they are taught in the school, how to put the needle, and what are the dangerous way of assessing your acupuncture treatment, etc. Then the acupressure is usually done by the chiropractors and the massage therapists. Usually the acupressure is done by pressing the acupuncture points. And then we have in Sri Yoga, Jagdish ji, right? Guruji, is it Jagdish ji?
Yes, Jagdish Karpara, yeah.
Yes, and he is giving a wonderful classes. So I would encourage everybody to take the classes, and so you can treat yourself and you can have a preventive health in as a lifestyle. And then the next mode of treatment is moxibustion. Moxibustion is this is actually the dried mugwort leaf. This is called aye in Chinese medicine. These leaves are rolled in the form of cigar, and then they are burnt. And the burnt portion of the leaf is shown next to the acupuncture points. And so this is kind of indirect moxibustion. That means you're warming up the channel so that the chi is moving freely at that point. And then the pain, because the pain is experienced when there is a blockage of the chi circulation. So to relieve the pain, you give moxibustion. And usually the moxibustion is given for damp conditions where the body is contracted. There is a lot of joint pains, and there is digestive problems and things like that. And then there is another form of therapy known as cupping. The cupping is applying a vacuum in different portions of the body, so that the concept is that when you put a vacuum suction, there is a fluid exuding at that point, and then along with the fluid, the evil chi which is present in the deeper portion of the body is coming out to the surface, and you're kind of treating the patients. Usually this is done in the back during acute respiratory illness like cold and cough. So because you put the cuppings in the back along the where there is lung, so that the evil chi like damp and heat, everything is taken out through cupping. The other form of treatment is gasha. Gasha is another mode of treatment where you put coconut oil on the back of the body, and then you scrape that portion of the body with a blunt spoon. So by doing the scraping, you're exposing little blood vessels, which exudes fluid, and then the evil chi is taken out. And this is also used in acute respiratory illnesses. The acupuncture, again, another one is present day, they do electric stimulation. That means they put electric stimulation to the points of the acupuncture needle so that your acupuncture treatment is much more effective. The third type is bloodletting. Bloodletting is using small bloodletting device like Lancets in the ear. So you take a few drops of blood, so you can see the definite dropping of the blood pressure. And sometimes when the blood is stagnated, the blood vessels are dark blue, and then you take out few drops of blood, which is very dark in color. Once that is let out, and then usually the pain disappears. That is another way of treating in oriental medicine. The other aspect is the auricular acupuncture. This is a very interesting and modern concept, and this is, though originally it was from Chinese oriental medicine. It is later developed in France, where the concept is, you can see an ear in the figure. The fetus or the small baby is represented upside down in your ear. So the whole entire body can be treated using small seeds, putting seeds or putting small needles along the in the ear, and the whole body can be treated. So if you have issues in the face, the lobe of the liver, the lobe of the ear is treated. If you have any back vertebral body issues, the acupuncture, instead of putting needles in the back, you can put on the rim of the ear, and the internal organs are along the inner side of the ear. This is a very very convenient way of oriental medicine treatment, because here in a room, you can have 10 to 20 chairs, and then 10 to 20 patients can be there. And then usually 3 or 4 acupuncturists can take care of 20 patients in same amount of time, instead of having 20 rooms. And then this is usually done in where there is a heavy earthquake or floods or something, where the usual emotion is a lot of fear and anxiety. These are the people who needs to be calmed down. So you do the auricular acupuncture treatment in such situations. Next one is the massage therapy. Massage therapy, this is usually the shiatsu massage, where the acupuncture points are massaged, and the therapy is given. This is very similar to the massage therapy given in Ayurvedic treatment. The other one is the herbal medicine, which is a big part in Chinese medicine, because many of the herbs are medicinal herbs, and these can be given in different proportions. And then there is a hierarchy of the herbal medicine, a formula in Western medicine. When you give a tablet, you have to see the side effects and you have to give another tablet just to compensate the side effects, the unwanted effects of this medicine. Unlike here in Chinese medicine, where the formula is prepared, that means you add different herbs and make your own herbal prescription. And that is how the the formula is prepared. So there is usually a chief herb, that means the herb which treats the disease, and then there is a ministral herb, that means that is the herb which can either help or it can treat the unwanted effect of the chief herb. And then there are assistant herbs, that means these are the ones who support either the chief herb or the ministral herb. And then there is the envoy herbs, that means these are the herbs which are used, which when it is given in the formula, they direct the action of the herbs to that particular to the organ. So the herbal medicine formula is extremely interesting, and these medicines, most of them are just regular medicines like turmeric, ginger, or cardamom, sandalwood, even the what is it? The jeera, cumin. So these are the herbs, and these are taken in a very organic manner. They are cultivated in organic manner. Ginseng, these are all the herbs, and these have powerful effects. And then a person, if he knows the way of treating, can give this herbal medicine and can and treat the patients. Last one is surgery. Surgery plays a very minor role in Oriental medicine. This was practiced in the 7th century when Huto, this was a surgeon, he had many surgical instruments, and then he did surgery at that point. But the surgery went in decline after that because of the acupuncture and the herbal medicine came in effect. So the surgery was not, it did not it did not proceed as rapidly as other forms of treatment. Next slide, please. Next slide, please. So now I just want to have a few ideas. These are my own ideas. Comparing the Oriental medicine and Ayurveda. Of course, I am not any learned any much of knowledge in Ayurveda, but whatever little I know, I thought I will compare. Both of them are ancient forms of medicine. These are medicine coming from the 2nd century, and Hongdi is the Yellow Emperor in Chinese medicine. He and his minister Chibo, they had like an Upanishad. They had question and answer sessions, and then they described the whole Chinese medicine in Oriental medicine. In Ayurveda, it is the what is that the name of the no, the Ayurveda, the person who did the, I mean, they put the whole Ayurveda, I forgot his name. So anyhow, these are all the ancient forms of medicine, and it has a holistic approach.
There is Charak, there is Shushruth, there is Vagbhat.
Yeah, and no, I'm talking about the person who had the 6 ways of Ayurveda treatment. Who is that?
The Shatkarma.
Yeah, I mean the
Ayurveda is Panchakarma.
no, these are the forms, but I'm talking about the principles. Who has established the principles of Ayurveda medicine? Yeah, you talk about no. I right now I can't. Yeah, because what I'm saying is they are both holistic approach. It is not like you go to a psychiatrist, you go to an ear, nose, throat person, and
Yeah,
it's not.
is that the Dhanvantri?
No,
Just-
not Dhanvantri. Dhanvantri is the deity, but I'm talking about.
I think somebody has the right answer. Charak.
No, I mean, even recently they had this. I forgot. I'll get the name later on. And then the next one is the basis of treatments are very similar, like prescription as a diet, food as medicine, lifestyle changes, exercise, massage, living in harmony with the environment, and feng shui or the vastu. These are all the ways of treatment in both alternate medicine. The concept is similar. And then next is the concept of chi, that is what is called prana in Ayurveda. So the concept is again same. And then the 5 elements of oriental medicine is similar to Panchabhuta, but only the 2 elements are different. You have metal and wood instead of Vayu and Akash. No, not Vayu and ether. Yeah. And then the other factor is the pathogenic factors are similar. Both of them talk about same external, internal, emotional factors. Then the prominence of stomach chi or jataragni is stressed in both areas. Again, this is about the way of eating. You eat in a calm atmosphere, and then there is no arguments or anything. And then you don't go and eat as you go, eat a bite here and bite there. That is not the way to eat. You sit and in proper time and proper meals, and then you have to have all the 5 colors of the organ, like green vegetables and representing liver, and yellow vegetables enriching your spleen, and then red vegetables for the heart, and pale or lighter vegetables like strengthening your lungs, and darker vegetables or bluish vegetables for the kidney. So these are the varieties of vegetables you need to eat. And then you have to have, there are some, usually the encouragement is to eat vegetarian diet, but even the meat diet is eat in moderate amounts. And that is the principles of Jataragni, and even the Taoist way of eating is very similar that way. And then eat with a lot of chewing and nourish, and then you see the food and then taste and smell the food, so that you start producing more of gastric juice, and then that is how increasing your Jataragni. And again, you even say a prayer like Brahma Pranam, Brahmahavihi, Brahmagno, Brahmanahutam. So these are all the ancient ways of increasing your Jataragni, and even making achmana, putting a little bit of rice and a little bit of water before you start your meal, just to stimulate your Jataragni. And then the versus meridians and nadi, they are the same. Meridian versus nadi, they are the same. You call meridians the channels in Oriental medicine, nadi in Ayurveda. And then representing the dew channel that is similar to Sushumna nadi, Inchav and Inve representing Pingala and Ida nadis. Next slide, please. And then the exercise.
Just I want to mention it's 9:05 and it is fine. You continue, but just for the audience, so running a little bit late, which is fine. This is a very vast topic, and thank you for covering so much in your presentation. Thank you.
Thank you. And then comparison continuing, Tai Chi and Qigong exercises, where there is breath and exercises by oriental medicine is very similar to asanas and pranayamas. And meditation represented as mindful way of life in oriental medicine, and living in the present form in Ayurvedic medicines. And then shiatsu is the massage therapy in oriental medicine, similar to oil massage, what happens in the in Ayurveda. And feng shui as similar to vastu. And then bloodletting is done in oriental medicine, but this is practiced by using leeches, I hear, in Ayurveda practice. And then acupuncture points are actually the marma points, which are advised in for patients with martial arts in Ayurveda. And these marma points are the very powerful points, which are even you can revive, or a patient can die if he's injured. And then in the chakra, one of the acupuncture point, extra point, is intang, which is a needle put in between the brow chakra. That is where you have the brow chakra. And that actually puts the patient to sleep, and they go in such a calm treatment procedure. And every time the patients come, and then they say they want intang, because that is where you have the meditation, and that is the powerful point, which in both the medicines are present. And then the Mingman fire is represented by Manipura chakra, the Ren 1, Dew 1, Chong point, meeting points represent the Muladhara chakra. And then the Sastra chakra is by Dew 20, that is another point. These are all very similar points. And the examination of tongue, pulse, and external appearance are very similar modes of diagnosis in both types of medicine. Next slide. Next slide. So this is in my conclusion remark is integration of Ayurveda, Oriental medicine, and other forms of alternative medical approaches, along with allopathic medicine, would complement each other and benefit the patient outcome. Because in China, what I hear is in the same hospital, there will be one wing of Oriental medicine. The opposite side of the wing is the allopathic medicine. So both the healers, they communicate each other, and the patient gets a holistic approach. And so if we can take the good points of meditation and spiritual practice of Ayurveda, and lifestyle a practice of both the medicine, and then the Oriental medicine, the importance of acupuncture, and then the other alternative medicine, homeopathic, and there are Siddha Vaidya. All these good points, if you can assimilate, and if you can integrate this with your allopathic medicine, you will do a better service to the patients and to the humanity. And this cannot be done at the stage where everybody's practicing, because by then everybody is an expert in their own field. But I think it should be starting from the time where they go to medical school, or where they enter the school of Ayurveda or any of the alternate medicines, so that they are exposed as medical students to these, and so that they can take the expertise. Like here in this country, you have MD, PhD, they do the PhD along with MD. So your PhD 1 year you can spend in knowing acupuncture or knowing ayurveda, anything that way. That way you acquire knowledge of both and get the good points of both, and then give a holistic approach to the patients, and then do a human service to the mankind. Thank you. Any questions? Next line.
Thank you very much, Sheela.
Oh, thank you.
You covered lots of things in a short time. All right. Thank you, Sheela. It's almost 9:30.
Thank you very much, Sabnishji. I really appreciate your encouragement. Thank you.
Oh, you are very welcome. And it's good. I think we'll try to think about some special session on some kind of specific topic or something like that. Okay.
Thank you.
Thank you.
Thank you. Bye.